This is the first of 8 brief talks on the cultural formulation interview. It is a part of course number 504, Abnormal Psychology, from Adler Graduate School. The cultural formulation interview evolved out of the outline for cultural formulation that was included in DSM-4. It is a semi-structured interview which encourages the clinician to ask additional clarifying questions on the topic areas. Thus, it is an organizing framework for information gathered about a client regarding the impact of culture on their life. There is also a glossary of cultural concepts of distress in DSM-5. The final project for this course is to administer the cultural formulation interview to a colleague or friend who is role-playing a client. We will begin with some definitions from page 749 of DSM-5. Culture refers to a system of knowledge, concepts, rules, and practices that are learned and transmitted across generations. Culture includes language, religion and spirituality, family structures, life cycle stages, ceremonial rituals and customs, as well as moral and legal systems. Cultures are open, dynamic systems that undergo continuous change over time. In the contemporary world, most individuals and groups are exposed to multiple cultures, which they use to fashion their own identities and make sense of experience. These features of culture make it crucial not to overgeneralize cultural information or stereotype groups in terms of fixed cultural traits. Race is a culturally constructed category of identity that divides humanity into groups based on a variety of superficial physical traits attributed to some hypothetical intrinsic biological characteristics. Racial categories and constructs have varied widely over history and across societies. The construct of race has no consistent biological definition, but it is socially important because it supports racial ideologies, racism, discrimination, and social exclusion, which can have strong negative effects on mental health. There is evidence that racism can exacerbate many psychiatric disorders, contributing to poor outcome, and that racial biases can affect diagnostic assessment. Ethnicity is a culturally constructed group identity used to define peoples and communities. It may be rooted in a common history, geography, language, religion, or other shared characteristics of a group, which distinguish that group from others. Ethnicity may be self-assigned or attributed by outsiders. Increasing mobility, intermarriage, and intermixing of cultures have defined new mixed, multiple, or hybrid ethnic identities. Culture, race, and ethnicity are related to economic inequities, racism, and discrimination that result in health disparities. Cultural, ethnic, and racial identities can be sources of strength and group support that enhance resilience, but they may also lead to psychological, interpersonal, and intergenerational conflict or difficulties in adaptation that require diagnostic assessment. This is the update of the DSM-4 outline for cultural formulation that is now in DSM-5. It serves as the foundation for the interview. After the questions were developed, the interview was field tested for diagnostic usefulness among clinicians and for acceptability among clients. These categories can serve as a beginning outline for the presentation of your interview findings for the final project. First, describe the person's racial, ethnic, and/or cultural reference groups and the impact these affiliations have on his or her relationships, the availability or resources, and any challenges, conflicts, or predicaments that emerge from this affiliation. It may be beneficial to contrast the person's culture of origin with their host culture or with the majority culture. Language or languages spoken and with whom they are spoken can often provide illumination. Other relevant information can include religious affiliation and practices, socioeconomic status, family of origin, birthplace and history, and immigrant status. Sexual orientation may also be relevant here. Second, are there ways in which this background and experience influences how the person experiences, understands, and communicates his or her symptoms or problems to others? A review of the cultural concepts of distress from DSM-5 may be helpful. Inquiry into the use of professional as well as traditional, alternative, or complementary sources of care is appropriate here. Third, does this background and experience serve as a lens through which stressors and supports are viewed? And fourth, does this background and experience impact the forming of a relationship with you? Are you likely to be seen by the client as a person to be trusted and effective in providing services? The cultural formulation interview is available in DSM-5 beginning on page 752. It is divided into two columns. On the left are guides for the interviewer, and on the right are specific questions as well as instructions for the interviewer. The 16 questions are divided into 4 domains. The interviewer is encouraged to probe and prompt further, and examples are given of language to use in the probing. It would be a good idea to work through the 16 questions and get comfortable with asking them. The American Psychiatric Association also published some supplementary modules to the core cultural interview, and it is these 8 supplementary modules that we are using in the personal reflections assignments for this course. The module for this unit is the explanatory model. The focus of this module is on how the person understands the problem or problems they are experiencing. If the person is reporting more than one problem, you may find it beneficial to explore each of them separately. It is often useful to explore the course of the problem. When did it start? What do you think may have caused it? What makes it better or worse? What do you think is likely to happen? It can be useful to identify the person's sources of information about their problem. Information about the problem that was obtained from the media or from the internet can be a powerful influencing force. It may also be fruitful to inquire about family members, friends, or acquaintances that have had a similar problem and what became of them. Try to develop your own set of questions that will help you understand how a person understands their problem and the language you will use to report your findings in your report. Remember that your assignment for the CFI Personal Reflections is to consider a problem you are currently having or one that you have had in the past and discuss your explanatory model for this problem. There are 4 topics I want you to reflect on. First, how did it feel to process your thoughts in this way? Second, did this exercise give you any insight into yourself? Third, did this exercise change your understanding of the explanatory model component of the CFI? And fourth, what impact did this exercise have on your style of inquiring into the explanatory model of the CFI with your future clients?